Good evening and welcome to RFL. I'm Richard French. Today on Capitol Hill, the first congressional hearing about coronavirus and how the Trump administration has responded. Many of the senators and health officials spoke from their homes or offices, people in the Senate chamber spaced apart. Now, one of the biggest headlines to come out of the hearing was Dr. Fauci's response when he was asked about the dangers of reopening the country too soon.
There is a real risk that you will trigger an outbreak that you may not be able to control, which in fact, paradoxically will set you back, not only leading to some suffering and death that could be avoided, but could even set you back on the road to trying to get economic recovery.
And an unlikely source is also warning, believe it or not, about the risks of reopening. I'm talking about none other than Jared Kushner, the son-in-law of Trump and senior advisor, I should also add. He told Time magazine today there is an inherent risk in the president pushing Americans back to work, but Trump carries the burden of 30 million Americans who have lost their jobs. Now, while President Trump was making his case for the country to reopen yesterday, he also made this false claim.
You see the numbers are dropping very substantially. The numbers are dropping around our country very, very substantially.
In fact, when you remove New York from the equation, rates are going up across the country. NBC News got its hands on a report from Trump's own task force, his own task force. The report saying many areas of the country are seeing a spike, especially in America's heartland. And when you take a look at this map, you will see those are the same areas that are starting to reopen. That is a type of thing that certainly poses concerns for Dr. Fauci. But LA County, it is going in the opposite direction. The public health director says it now will most likely extend the shelter-in-place orders until the end of July. Now, let's go back to Dr. Fauci. He also said today that the actual number of deaths is likely higher than the official count of 81,000.
Most of us feel that the number of deaths are likely higher than that number. So in direct answer to your question, I think you are correct that the number is likely higher.
A direct contradiction with the president, who said he believes the number inflated. Also, take a listen to what the president had to say about just the very subject we touched on yesterday.
They should all be able to get a test right now. They should be able to get a test. If somebody wants to be tested right now, they'll be able to be tested. This week, the United States will pass 10 million tests conducted, nearly double the number of any other country. We're testing more people per capita than South Korea, the United Kingdom, France, Japan, Sweden, Finland, and many other countries, and in some cases combined.
At today's hearing, Senator Mitt Romney, Republican senator, took exception to what Trump said about testing, especially compared to South Korea. Here again, the Utah Republican.
I find our testing record nothing to celebrate whatsoever. The fact is their test numbers are going down now because they don't have the kind of outbreak we have. Ours are going up as they have to.
In fact, we're not even finding ourselves in the top 20 per capita globally. I want to bring in our guest, Dr. Joshua Sharfstein. He is a physician and vice dean at the Johns Hopkins Bloomberg School of Public Health. I have a lot of specific questions dealing with testing and some of the other components of what we're confronting now. But from a messaging standpoint, and obviously I'm pivoting off of the testimony I heard earlier today, you've seen the credibility rates that Dr. Fauci, Dr. Redfield, and others have, and I know the imprecise nature that comes along with a thing like a pandemic. But given this tribalized information consumption world we need, I think at times more clarity, and I don't know how we politicize things like a pandemic, but somehow we have. Do you find it difficult where you'll get, I understand why, but all these qualifiers when the experts say this might happen or the CDC won't give declarative hard lines as what states should and shouldn't do as they're getting to reopen? It almost creates a void where some irresponsible behavior fills that void because they're saying, well, nobody really knows. I understand on one hand, we don't know all the answers, but on the other hand, without giving harder deadlines, I find at least, tell me if you disagree, that into that gap gets some really dangerous guidance from people who shouldn't be giving it.
Well, it's the nature of science that we want to be careful about predicting the future. We want to say what might happen and what people can do to prepare for that. I do think there's probably a role for CDC to be a little bit more declarative than it has been to date. I think the federal government generally has pulled back on giving clear guidance in a lot of different areas. And I think, and having a more clear role, and I think that has fostered a lot of confusion.
Well, to that end, talk about what Dr. Fauci seemed to be getting at today, which is without real mitigation, reopening too soon. He wasn't just saying could have another spike here, but could be particularly dangerous. Do you have any fears? Every pandemic has more than one spike, that the second spike could actually be worse potentially than the first one?
Oh, certainly. I mean, the first spike really wasn't the full spike. The first spike was it started going up and we shut everything down right away. And so we blunted what potentially could happen. And so it could be much worse if it really spreads and people don't feel like they can shut everything down again. You know, and they go, well, this time we're not going to shut everything down. It will be worse if that were to happen. So I think the fear there is real.
To that end, we've seen even some internal White House reports that came to light yesterday that in the heartland, we're starting to see higher levels than maybe some of the cities on both East and West Coasts, which were more the poster children for the first round. Talk about your concerns within the medical community about how ill-equipped certain facilities are that might have a single ventilator, let's say, for the entire ICU. Are you concerned about geographically where this might hit on how the problems could become even more acute?
It doesn't take a lot to knock a rural medical system off of its stride. There really aren't a lot of beds, staff, key facilities. So, you know, people say, well, we haven't had that many cases, but, you know, one church choir gets sick or one outbreak at a local employer and or one nursing home. And suddenly you could be swamped and the healthcare system could really be overwhelmed. So I think it's really important to put that in context when you're looking at regional differences.
You know, it's interesting, Doctor. I spoke to just people not even involved in my business or certainly in the medical community, how confused they were after yesterday afternoon's White House briefing as vis-a-vis testing. Is it required? Is it important? What good does it do? The president certainly said, hey, forget what happens in the White House and the rate of testing that we're doing. Unless you're feeling sick, you don't really need it. We contrast that now with two figures. One, the idea that we're the best in the world at this. We're not even the top 20 as it relates certainly on a per capita level. And more than that, we see what happened in Wuhan now, where there's another outbreak, and they plan over 2 weeks to test all 11 million residents. What kind of clarity do you think, give if you can, to my audience, the value of testing, how frequent it should be, and who should get it, whether or not they're exhibiting symptoms?
Sure. So there's some very clear priorities for testing. It's very important to test people with symptoms because we want to find cases of the illness as quick as possible in order to trace their contacts, isolate the individuals involved, and prevent the virus from jumping from person to person. It's very important to test people in the hospital so that doctors and nurses know what they're treating. We need to be able to provide a lot of testing for very high-risk facilities, particularly in a setting of outbreaks like nursing homes or shelters for the people experiencing homelessness or jails and prisons. Very, very high priority. Now, once you get past those, and that also, of course, includes first responders and others, what is the role of just testing people who have no symptoms, no exposure? That's not totally clear yet. It certainly makes more sense in very high-risk settings like nursing homes, so regularly testing nursing home workers because of the incredible high risk of death. But we're limited by a couple of things. We're limited by the supplies, we're limited by the expense, and we're also limited in a way by how good the tests are. So if you're testing a very, very low-risk population, you could wind up missing some of the only cases that happen. You could wind up with false positives. And so I think the value of testing just everyone all the time is unproven in my mind, but we're not anywhere near the testing levels that we need to do the core building blocks of a strong public health response, which is testing to find people who are infected, tracing their contacts, isolating, quarantining, and slowing down the spread of the virus.
And finally, Doctor, I'll bring it full circle. The one part that I thought it was notable that Dr. Fauci was pretty declarative on was the concerns about opening schools in the fall, given what we're starting to see with children's exposure, with COVID, and I guess with the connection with the Kawasaki disease. Talk about that. I know we're learning so much week by week, or learning what we still don't know about this virus. How about, from your perspective, the concerns as it relates to children, not just being carriers potentially, but also becoming sick with this as well?
Well, I'm a pediatrician, and my training took care of a number of children with Kawasaki disease, and it's a very, difficult and at times frightening illness. It's obviously a very rare condition, but nonetheless very serious. I think the question about schools is going to relate to a number of different factors. One of them is going to be the overall level of community spread. If there is still a lot of circulating coronavirus in the fall, it's going to be very hard to have anything that looks like a regular school experience. If we can get the level of circulating coronavirus way down, then you could imagine a modified version of school that would be very nimble, would look like maybe fewer students in class at a particular time, extra protections for teachers, but we really have to think that through.
Dr. Sharfstein, I appreciate the time. Thank you.
Thanks for having me.
And up next, a former Democratic senator joins us to discuss the government response to COVID, how the president and Mitch McConnell are playing politics with state aid, and much more.